and you wanted to change its behavior in fundamental ways, what would you do in today's world? Anybody? Genetic engineering. You change the DNA. So the question, you can think about this question as, what are the pieces of DNA in the public sector that are so fundamental that if we change them, we'll get different behavior? And based on my research around the world, it's these 5 things. It may apply to private organizations too, but I'm just claiming public. An organization's purpose and its clarity of purpose, and how whether all the employees understand what that purpose is and are driven by it, whether your budget is driven by it, your incentive system, your accountability system, your power structure, that is, how hierarchical, where do decisions get made, are they getting made at the appropriate level, and your culture. Now, when you write books, you look for cute gimmicks to help people remember your ideas, so we talk about 5 strategies, all that begin with the letter C, the 5 C's, to change these 5 levers. Creating clarity of purpose in organizations, creating consequences for performance, accountability to the customer, decentralized control, and a culture that's focused on innovation and results. I don't have time to go through all of that this morning, but I'm going to give you 3 big examples, or three examples, to show you the ways you can use these strategies, what it means. So, in terms of getting clarity of purpose, the most important driving force in any public organization is the budget. Where the money goes, how that gets decided, what strings are attached, what incentives are attached. We need, given today's realities, we need a budget system that lines the money up behind the results citizens want, that gets rid of the low-value spending that's not contributing much to those results, that allows us to move money into much higher value areas, to invest in the things we need, to change, to improve, and that motivates all the managers to find better and cheaper ways to get results. That's not the kind of budget system we usually have in the public sector. Normally the way it works is, if I'm a program manager, when I get the budget instructions every year, they basically say, tell us what it would cost next year to do what you did last year, the way you did it last year, with the results you got last year. That's the implicit question. And what I do is I take last year's costs and I add inflation, and I add any caseload increases, if that applies, or anything the city council or county board or state or governor's office or state legislature has asked me to do that's new, and that's my new base. And that's what I submit. And, it's 5 or 8% higher than last year, and if I get cut from it, I scream. Even though I'm getting more than last year, I scream about getting cut. And the truth is, I know that in this environment, I am going to get cut. I'm not going to get everything I asked for. So what do? What is the incentive I have? I load it up. I pad my request. And if I'm experienced and smart, I hide it really well. So the budget office has an army of budget analysts. And what is their job? Find the padding. It's a giant game of hide and seek that goes on. Every year, it takes enormous energy. We spend a lot of money on it. And it's no fun for anybody. But even worse, most of the energy, 95% of the energy in the whole process goes into, what are we going to cut? Or what are we going to spend new? Or what taxes or fees are we going to increase or decrease? And frankly, that's marginal. That's less than 10% of the budget, usually. And 90% of that budget goes through unexamined every year, just unexamined. But it doesn't have to be that way. 6 years ago in Washington State, when they had a 14% shortfall that they had to close, and they'd already lost a tax initiative, 70-30 at the ballot, knew they couldn't raise taxes. Governor Gary Locke, who's now the Commerce Secretary, hired us to help him deal with the problem, and we helped him invent a new way of budgeting, which we call budgeting for outcomes. It is the single most powerful tool to deal with fiscal problems I've ever seen, and it has spread already to at least this many places because it works so well. And I want to tell you a little about it because it's something you all ought to be doing. The basic idea is get the focus in budgeting from inputs, which is how much are we going to spend for X, to results, to outcomes. What results are we delivering? It asks 4 basic questions. You start at the beginning by deciding how much you're going to spend next year. Usually that question is answered at the end of the process. You get a policy decision at the beginning. You can change it at the end, but you do your revenue projection, you decide whether you need to raise taxes or not, you decide how much money you're going to have. Then you figure out what outcomes matter most to the citizens, what results. Then you figure out how important are they? How much should we spend on each one? How important is better education compared to better mobility, compared to a better environment, compared to better health? And finally, you figure out how best to deliver each of those outcomes. So when I talk about outcomes, this is the kind of thing I'm talking about. This is from Spokane, Washington, and they phrased it in terms of how a citizen would say it. So you can see, this is a typical kind of list. Usually education's on there, health is on there, something about the environment, something about a better government, public safety, a better economy. These lists vary a little bit from place to place, but it's pretty much mom and apple pie. It's pretty clear. It's not hard to do this. The Republicans and Democrats don't disagree much about this stuff. And most places ask the citizens. They do surveys. They do focus groups. You get a lot of input. And it's, you know, usually there's 8 to 10 things that the public really cares most about. So once you've got them, you create a team of people we call a results team around each one. And their job, they are supposed to be strategic thinkers who understand that policy arena from inside government, and we even argue you ought to bring some outsiders in, some people from think tanks and academia and so on who really understand that policy arena. Their job is to buy for the citizens, to buy results. The first thing they do is figure out how to measure the outcome. You know, we suggest 3 indicators for each one, which gives you, if you have, say you had 8 outcome goals, that gives you 24 indicators. It's a great scorecard for your government. How are we doing each year at producing the results the citizens want? The second thing they do, most important, is figure out what really matters. What affects this outcome? Forget what we do in our city or county for a moment. What affects the outcome? And to help figure that out, they do a lot of research, look at data, and we get them to create a visual picture called a cause and effect map. I'll show you what I mean. This is from Washington State when they did health, their first health cause and effect map. Every bubble on there is a factor that affects the health of the community. But the research, and there's been a ton of research on health, tells you that it boils down to 4 big factors. They all contribute to 4 big factors. What's in the environment, personal behavior, you know, how much your diet, your exercise, smoking, drinking, drug use, all kinds of things, access to quality health care, and risk factors, both genetic, like maybe some people are born predisposed to heart disease, and socioeconomic, because it turns out that if you're born poor in America, you're at risk of poor health, at far greater risk. So those are the big 4 factors that you can, that have an impact. And that led the folks in Washington to say, wow, maybe we're not focusing on the right things. They found some data, and this is about 10 years old, but the trend is still the same, that basically says we spend most of our money on access to care, and yet 50% of the outcome is determined by personal behavior, and only 10% by access to care. And that's very true. You know, we are in the midst of a new epidemic in this country because of our diet. We eat too many carbohydrates, and it leads straight to diabetes and heart disease.